Welcome back. Coronavirus infections continue to soar far above previous peaks. More than 1 million people in the U.S. were diagnosed with the virus alone on Monday. That's the highest number of cases reported by any country in a single day since the pandemic started. Joining me this afternoon to discuss the latest on the virus is Dr. Jen Ashton, ABC News Chief Medical Correspondent. Good afternoon, Jen Ashton. How are you doing?
Thanks for having me. I'm great. How are you?
I'm good. Thanks for coming. More people are vaccinated than ever before, but we're still seeing the highest number of COVID cases ever. Why is this?
Well, I think the answer to that is complicated, but, it's how the virus behaves and it's how we behave. And certainly both Delta and Omicron are really throwing a ringer into this, which is, believe it or not, the third January that we are living with COVID-19. But I have to tell you, there's some controversy in the world of epidemiology, public health, and infectious disease about whether or not we should even be tracking daily case counts, because what really matters is our hospitalization rate and our death rate. And we have to remember that a lot of these rapid or at-home tests, those results are not even being collected or reported to departments of health. So there's a question about accuracy, and it takes a lot of resources. And if it doesn't change behavior, then there's a question of why shouldn't we eventually, at this point in the pandemic, move to weekly case reporting instead of daily. But it's a complicated and, of course, controversial topic for sure.
Yes, of course. Some governors, including the governor here in Massachusetts, are pushing for schools to continue in-person learning, while others are opting for remote learning. Is it safe for students to be in person in their classrooms?
Well, I think the short answer to that question is overall, is it safe? Yes. And we have data to support that the risk inside a classroom to children, to the pediatric population, is actually relatively low. It can be one of the safer places in the setting of this pandemic. We also, of course, have to remember that there are adults and staff and faculty and adults that those children then come into contact with. So we have to remember them as well. But I think the reason you're seeing governors push for that, as well as the American Academy of Pediatrics and the CDC, is that we know that there are real risks to keeping children out of school. So it's not about risk benefit only. It's about the risk of keeping them in school versus the risk of keeping them at home. And we've seen earlier in this pandemic that the risk of keeping kids out of school overall to their health is actually greater than the risk of having them in the classroom.
Awesome. Thank you. Dr. Ashton, that's all the time we have for today. Thank you so much for joining us.
Pleasure to be with you.